Hello, it's Dr. Elizabeth Alter. Are you wondering about hormones? So, this is often a struggle with patients is whether or not hormones are safe and if they really need them. Now, it's it's normal as we age to lose our hormones, and obviously women go through menopause, and then for men, they don't produce as much testosterone, or they um, they gain belly fat, which then produces more estrogen, and that competes with testosterone. So either scenario is a time for decision making about what to do. Now, the first thing that I always like to clarify with both women and men is that hormones are not just um, the fad. Many there's many advertisements for hormones, and sometimes they promise youth and um, having better intercourse and these kinds of things. But hormones go beyond that, and I always remind patients that it's really important for memory, vision, and mobility, and heart health. So these are things that as we age, we want to support. It doesn't mean that we're going to be 20 again, but if we do it in a smart and healthy way, it can be beneficial without being concerned too much with the risks. Now, I always warn my patients of, certain clinics or programs um, that promise you certain results. So right off the bat, as doctors, we when we treat with hormones, we have certain ways of measuring and testing. And obviously, the follow up with the patient is important to make sure that everything's being done in a safe way. And I always tell patients to make sure that whoever they're seeing, so when I see patients in terms of hormones, I make sure that they are detoxifying properly. Because even though hormones may be helpful, you have to help your body metabolize them properly. So let's say you're a patient who's constipated. Well, before you start a hormone program, you need to make sure that that your constipation is resolved. Because if not, then that can cause problems with the metabolites or the products of metabolism of your hormones. So keep in mind that there are also, some natural ways to maintain your hormones. It's not as effective as taking hormones, but I work with those patients too that are just, because of family history of certain cancers, they really are not ready for hormones, but still need the support. So there are various ways of doing this, and it's important that you shop around for the right doctor for that. And as I always tell my patients, there's sometimes clinics that will open, and they after they make a certain amount of profit, then they're off the market. So make sure you go somewhere where it's an established practice, and it's not just something that they're going to do short term, and then you need to look for someone new. But keep in mind that hormones can be healthy, and keep yourself informed and an educated consumer. Thank you, and have a healthy day.